If you want to see more detailed images, videos, and the full article, check the link in the description. A shocking new report reveals a critical failure within the UK's National Health Service, NHS, to address the escalating crisis of domestic abuse. Experts are now declaring domestic abuse a public health emergency, highlighting the NHS's systemic shortcomings in identifying and supporting victims. The report, compiled by Standing Together Against Domestic Abuse, STADA, paints a stark picture of a system overwhelmed and ill-equipped to handle the immense scale of the problem. The sheer number of people affected is staggering. Latest figures from the Office for National Statistics indicate that a startling 1 in 4 adults in England and Wales, that's 12.6 million individuals, have experienced domestic abuse. This epidemic of violence isn't merely a societal issue, it's a public health catastrophe, impacting every facet of life, from mental and physical health to economic stability and community well-being. The NHS, with its extensive contact with both victims and perpetrators, is uniquely positioned to intervene, yet this report exposes a critical failure to capitalize on that opportunity. STADA's research meticulously examined all official reviews of domestic abuse-related homicides and suicides published in 2024. The findings were devastating. Approximately 90% of these reviews cited significant safeguarding failures by the NHS. The most common criticism? A profound lack of adequate training for frontline NHS staff in identifying and responding effectively to domestic abuse. This is despite existing guidance from the National Institute for Health and Care Excellence, NICE, recommending mandatory training for all frontline staff. The reality, however, is that such training is described as sporadic and inconsistent, leaving countless victims vulnerable and without the critical support they desperately need. The report goes beyond the absence of training, highlighting a pattern of repeated failures across the NHS. Consistent deficiencies in risk assessment, information sharing, and coordinating care with essential specialist services are laid bare. Victims are often denied crucial referrals to alcohol and mental health services, and vital connections to independent domestic violence advisors are frequently missed, leaving victims isolated and with limited pathways to recovery and safety. This systemic failure to connect victims with essential support networks compounds the trauma and further jeopardizes their well-being. The gravity of this situation is underscored by a separate study published in the Lancet Regional Health Europe. This study reveals that a shocking 26% of women who died by suicide and were known to secondary mental health services had a history of domestic violence. This stark statistic underlines the devastating consequences of unchecked domestic abuse and the critical need for comprehensive intervention. The link between domestic abuse and suicide is undeniable, representing a catastrophic loss of life and a profound failure of a system designed to protect its citizens. The government's commitment to having violence against women and girls by 2034 is laudable, but the STADA report issues a stark warning: without urgent and comprehensive action, this ambitious goal remains unattainable. The report offers concrete recommendations, including the mandatory implementation of standardized domestic abuse training for all frontline health professionals. The call is for a fully funded and properly resourced training program, ensuring that every staff member is equipped with the skills and knowledge necessary to recognize the signs of abuse and provide effective support. Furthermore, the report emphasizes the need for significant improvements in data recording and information sharing across different healthcare sectors, ensuring a seamless and coordinated response to victims in need. The consequences of inaction are far-reaching and devastating. Experts are sounding the alarm, with some even referring to the situation as an epidemic of violence. Cheryl Henry Leach, the chief executive of STADA, powerfully articulates the urgency of the situation, calling upon the government to formally recognize domestic abuse as a public health emergency. Henry Leach asserts that treating domestic abuse solely as a criminal justice issue is a fatal mistake, emphasizing the critical role of the NHS in addressing this crisis. The voices of concern extend beyond STADA. Tim Woodhouse, a suicide prevention specialist, paints a grim picture, estimating that as many as 1,800 lives are lost annually due to domestic abuse-related suicides. He describes this as a national scandal, a tragic and preventable loss of life that demands immediate and comprehensive attention. Similarly, Andrea Simon, director of the End Violence Against Women Coalition, stresses the crucial role of healthcare workers as often the first, and sometimes only, point of contact for victims. She underscores the dire consequences of inaction, emphasizing the need for effective training and support for healthcare professionals. The Royal College of GPs, represented by Professor Camilla Hawthorne, voices its concerns, highlighting the potential for missed opportunities to assist victims given the trusted relationships GPs have with their patients. While welcoming the prospect of more training, Professor Hawthorne also emphasizes the crucial need for adequate funding and consideration of existing workload pressures faced by GPs daily. In response, the NHS has stated that all staff are required to complete safeguarding training on domestic violence and abuse, asserting that this training is currently undergoing updates. The government, in its statement, reiterates its commitment to tackling domestic abuse, highlighting its investment in NHS talking therapies. The government emphasizes its intention to develop a coordinated approach across various sectors, with a comprehensive strategy planned for later this year. However, the gravity of the situation cannot be overstated. The sheer scale of the problem, the systemic failures highlighted in the report, and the devastating human cost all underscore the urgent need for comprehensive, sustained action. The silence surrounding this issue can no longer be tolerated. This is a call to action, demanding that the necessary resources, training, and support systems be put in place, not just to prevent future tragedies but to heal the wounds of the past and provide support and hope for the millions of individuals who have been affected by this pervasive and destructive form of violence. The time for empty promises is over. This crisis demands immediate and decisive intervention. The lives of countless individuals depend on it. Remember, help is available. The numbers for national helplines in the UK, the US, and Australia are provided in the accompanying information, and further international helplines can be found at www.befrienders.org. Don't suffer in silence, reach out for help.